Welcome, everyone, and thank you for joining the fourth webinar in Cystic Fibrosis Canada's virtual education series for patients and caregivers. The webinar today will be recorded for those who are unable to attend and will be available through our website for later viewing. Following the presentation, we will have a question and answer session. Please use the raise your hand feature to be unmuted so that you can ask your question verbally, or alternatively, you can type your question in the Q&A box. We are very excited to have with us today two speakers to discuss transitioning from pediatric to adult care. Our first speaker is Anna Gravel. Anna has been the Cystic Fibrosis Nurse Clinician Clinic Coordinator at British Columbia Children's Hospital since 1993 and is adjunct faculty at the University of British Columbia School of Nursing. She served as a member of the 1997 Advisory and Development Committees for On Track, which stands for Taking Responsibility for Adolescent or Adult Care, a model of transition care for adolescents with chronic health conditions at BC Children's. From 2000 to 2008, she led a CF Quality Improvement Initiative at BC Children's, which resulted in a multidimensional CF transition program and includes a CF transition care clinical pathway and Readiness to Graduate questionnaire. Anna has also published several articles on the CF transition process. Our second speaker today is Christine Kerr. Christine is the mother of two boys, aged 23 and 21. Her youngest son was diagnosed with CF at 3 months. Christine has been involved in supporting CF in a variety of ways. For 9 years, she served as the editor of Vitality, a newsletter for the BC chapter of Cystic Fibrosis Canada. And more recently, she is a 4-time participant in Gear Up for CF, a 1,200-kilometer bike ride from Vancouver to Banff. And she'll be sharing with us today her family's experiences as her son was transitioning. Before we get started with the webinar, we'd like to run a very quick poll to get a feel for today's audience. Okay, so it looks like today we have a mix of parents of children who are going to transition and healthcare providers. So I'll pass over the presentation to Anna now so that we can get started.
Well, welcome everyone to this talk on transitioning from pediatric to adult care. I'd like to thank Cystic Fibrosis Canada for inviting me to speak today, and to thank Vertex Pharmaceuticals for their support of these webinar educational series. I'd also like to thank the CF team that I work with at BC Children's Hospital. They're an absolutely awesome team to work with, and they provide me with a lot of support. And I'm sorry I didn't put your name up here, but Christine Kerr, I'd like to thank you also very much for agreeing to speak in this talk today as well. Well, transition is not a new topic. In fact, I recently came across the proceedings from the first ever North American CF conference that was held in Toronto way back in 1987. And lo and behold, I saw that there was a workshop on transition to adult care. And while it was really encouraging to learn that transition has been viewed as an important topic for so many years, it's also a topic that has seen quite slow progress at times, and more recently I think it's picked up the pace a little bit, and I'm happy today to share with you a little bit more about where we are with CF transition today. So what is transition? Healthcare transition is the process of changing from a pediatric to an adult model of healthcare. The goal of transition is to optimize health and to assist youth in reaching their full potential. How do we do this? Through an organized transition process which supports youth in acquiring independent healthcare skills, preparing for an adult model of care, and transferring to new providers without disruption in care. And why is transition important? Well, I think we all know that there are several differences between the pediatric and adult healthcare setting. The pediatric setting tends to be more family-focused with perhaps a more protective or nurturing model of care, whereas the adult setting tends to be more patient-centered, perhaps with a stronger focus on partnership or collaborative model of care. In the pediatric setting, there tends to be much more parental involvement, whereas the adult setting focuses more on autonomy. The pediatric setting tends to have more of a prescribed model of care, whereas the focus is more on recommended care in the adult setting. And in both settings, certainly, there are a different set of expectations. Well, why else is transition important? I think we can all agree that we don't want our youth to be in the following position, where an employment officer says to the youth, "Have you any other skills outside of being able to shoot down 250,000 droids in a video game?" And in much the same way, I think we don't want our youth with cystic fibrosis to enter the adult healthcare system without the skills and confidence necessary to begin to navigate this system well. Transition itself is a process. Transfer is the moment of change to adult healthcare. And this is a really important point because the transition process spans several years, both before and into the adult healthcare system, whereas transfer is that one important but one moment of time. Transition certainly mostly refers to the teenage years, and it's sometimes useful to know what we're dealing with here. So I like this cartoon of the average teenage brain. If you see on the upper left, that love lobe is quite huge, and to the right of that, that rebellion center is pretty large also. And sandwiched in between the two is a pretty tiny judgment gland. You'll see over to the right, there's equal love and hate for parents, and down at the very bottom is one of my personal favorites, tiny little memory for chores and homework. But in all seriousness, teenagers or adolescents are challenged with certain developmental tasks that they will work on throughout their adolescent period. And these include the development of a healthy self-esteem or healthy identity, emancipation from parents. This is a huge one for all parents, but when you throw in a chronic condition like cystic fibrosis where the stakes are so high in terms of their health, it can be downright scary. The development of a healthy sexual identity is also a very important one, also can be fraught with a lot of anxiety for parents. Peer relationships become much more important to adolescents during this phase of life. And of course, the planning for vocational training and employment are also very, very, very important. So, we know that a certain maturity is required to fit into the adult model of healthcare, but we also know that not all teenagers have an equal level of maturity. Like this one boy who says to his friend, "Loosen your belt a notch, David, your underwear's not showing." And while the legal age in Canada may be 18 years, we also know that many 18 to 24-year-olds are still in the emerging adult phase, where they have not yet completed the transition to adult roles in families, in households, or in the workforce. And in fact, this can be quite a vulnerable stage, especially for someone with a chronic healthcare condition. And I think we now need to embrace the idea that certainly the transition process continues on into these early adult years, and that young adults would be well served by a continuation of the transition process into the adult healthcare system. So how are we doing with transition in Canada? Well, first of all, we know that in part through the wonderful work done with Cystic Fibrosis Canada, that there's an almost equal number of adult clinics to pediatric clinics. And on the one hand, you may shrug your shoulders a little bit and say, okay, so what? But this is in fact a really important point, because in the pediatric clinic, we need to know that there is an adult clinic to send our youth to. We need to have faith in that adult clinic, and we need to convey that sense of faith to our youth and their families when our kids are going through their teenage years. Secondly, we know that in Canada, we are transferring for the most part our youth to adult CF clinic at or around the age of 18 years. Now, this came from a survey that we did in our clinic in 2007 where we polled all of the pediatric CF clinic nurse coordinators across Canada. And when we asked this question, you can see that by and large the policy was to transfer at or around age 18. And while there are were some exceptions to the rule, this is really important. Just last year I was at a North American CF conference in the States where I overheard a doctor saying to one of their colleagues, I'm still trying to get my 30-year-old with CF to transfer to attend an adult CF clinic. And really that serves nobody well. So it's heartening to know that in Canada we're doing quite well with this regard. The other question that we asked in this survey was, does your clinic utilize a transition program? And this is what we found out. Only 22%, so less than a quarter of the clinics at that time, back in 2007, said that they utilized a formal transition program. About half said that they use informal actions but didn't follow a formal program. And these informal actions varied in the amount and in the type of things. So one clinic said that they just tried to promote independence early in their youth. Another clinic said that they held a yearly transition clinic. And this is usually a clinic, it's the last pediatric clinic visit where one or more of the adult team come to the pediatric center to meet the youth and their families. But in that clinic, that was the only transition action that they undertook. And about a quarter of clinics said that they did not follow a formal program nor engaged in any informal transition actions. Another way to look at this, click on this there. This is, of course, a slide of Canada. And if you look at the colors, so this is the same question and answer. The red indicates provinces where the clinics did not have any transition practices. Yellow indicates that they took part in informal transition practices, and green where they had a formal transition program. And when you look at the provinces, I guess Ontario and Quebec, please don't look at the geographical line. It doesn't mean that in southern Quebec there were no transition practices. It was more, I was just trying to show the proportion of transition practices. So 4 years later, in 2011, I went back and re-asked the same question, and this is what I found. So 4 years later, you can see that there's much less red and much more yellow and green, indicating that many more CF clinics in Canada have started to address the idea of transition. And I am really hoping that in the last 4 years, even more clinics, that we've seen more progress. And I'm not sure, but I'm hopeful. But you can still see that we're not there yet, and we won't be until we see an entire country with green, indicating that everybody is following some type of transition program. I'd like to spend the next part of this talk describing to you two different and really wonderful transition initiatives. I'd like to start off by mentioning that there are now many, many, many excellent models of transition throughout the world. Australia has done some great work, different places in the United States and Canada. And I've just chose to focus on these two. Got Transition is a transition initiative based out of Washington, D.C., and then On Track, as Tanya mentioned, is a generic transition service out of my hospital, BC Children's Hospital in Vancouver. This is the current homepage to the On Track transition service. It's actually, in the very near future, it's going to be updating their website. But if you were to click on today, this is what you would see. And one of the first things that stand out is that not only do they have supports addressed to the youth, but you can also see in the red that they have supports for the family as well, which is really wonderful. This is a screenshot from Got Transition, from the U.S. Transition Initiative, and you can see that they also have resources for healthcare providers, for youth and families, and in this one also for researchers and policymakers. So I'm going to spend the next several slides weaving in and out of both the Got Transition initiative and the On Track. And you're going to see that while these different transition initiatives may approach transition slightly differently, they really end up with the same important processes and messages. And I'm also going to weave in there a little bit of what we do at our clinic for transition. So GOT Transition identifies 6 important core elements which they see as being crucial to any transition program. And I should have mentioned, in the interest of time, I'm only going to focus on number 2 and 3, but I am going to mention the others. The first is they say that every transition program should have a transition policy. Now this is a very busy slide, and I'm not going to go through it all, but I'll just tell you briefly, so you can insert your name. Say I insert that the CF Clinic at Children's Hospital is committed to helping our patients make a smooth transition from pediatric to adult care. This process involves working with youth beginning at ages 12 to 14 and their families to prepare for the change from a pediatric model of care, where parents make most of the decisions, to an adult model of care, where youth take full responsibility for decision making. And you can see it goes on. Now, in our clinic, it made me realize that we don't actually have a transition policy. We do have an overall purpose statement of our clinic, and it does address transition, but I do think that this is very worthwhile, and I think this is something that we should have. The next core element is transition tracking and monitoring. GOT Transition has its own tracking and monitoring tool that you can see if you go on to their site, but I'm going to talk to you today a little bit about the tracking and monitoring tool that we use in my CF clinic. So I mentioned to you that the On Track initiative, that we became a part of it very early on, back in the mid-1990s. The first tool that they created was a generic transition pathway, which we adopted right away. And after about 4 years of use, we decided to adapt to become CF specific, and we've been using this transition pathway for many years now. Remember, I talked about that developmental approach to transition. Well, this pathway divides the process into 3 age groups: early transition at age 10 to 12, middle transition at ages 13 to 15, and late transition age 16 to 18. All of this, of course, happening at the Pediatric Center. Within each of those age groups, there are 6 distinct components to the transition process: self-advocacy, independent healthcare behaviors, sexual health, social supports, educational, vocational, and financial planning, and health and lifestyle. And I'm not going to show you the actual transition pathway because it's a very busy, or it would be a very busy slide, and it's 4 pages long. But I am going to show you just a snapshot from it. I'm going to show you in the late transition phase, age 16 to 18, under the component of sexual health. And it looks something like this, where on the left-hand side, there's a set of indicators or goals to be met, including having a basic understanding of the ability to have children, knowledge of appropriate contraception in CF, learns about reasons or process for genetic counseling or carrier testing a future partner, understands the risks of sexual behaviors on health condition, and understands the potential for yeast infections or stress incontinence and how to address the problem. And on the right-hand side are some of the suggested tools and materials. So this is something that healthcare workers would keep in the clinic charts, and we would review as part of our normal care of what we do at the CF clinic. Now, as I mentioned to you, On Track has and sorry, maybe I didn't mention this to you. On Track disbanded over several years, and then about 5 years ago came back much bigger and much stronger, because they found that after several years there wasn't as good uptake of their transition model as they had hoped, and especially within Children's Hospital. It did help to get other transition programs throughout the world up and going, but they felt that they needed to come back and and update their information, and they've done so on a much more comprehensive and on a bigger scale. So today, they have updated their generic transition pathway. And again, I'm not going to show you the whole pathway. I've chosen to show you a snapshot of the self-advocacy page. You can see on the left-hand side that there are certain skills to work on. The youth should come to each visit with a question, practices meeting with practitioners on their own, can name and describe health condition, knows symptoms to report when getting sick or having complications from the condition, confirms a family physician and visits at least once a year for primary care, checkups, referrals, prescription refills, birth control, or emotional concerns. And you can see that on the top that this transition pathway starts a few years later. And one thing that I really, really like, it now contains an adult component. And there's not, each of these goals don't happen on a separate page. They've decided to consolidate it onto one page. And I'd like to tell you today that about an exciting new initiative in the province of British Columbia. Very recently, the 2 pediatric and 2 adult CF clinics met, and we have decided that with the support of On Track Transition Initiative, that we are going to adapt this new transition pathway to be CF specific. And all 4 of the CF clinics in BC, the pediatric clinics in Victoria and Vancouver, and the adult clinics in both places are going to start to utilize one common transition pathway. So we will start it in the pediatric clinic, and then we will hand it over to our companion adult clinic so that they can continue the transition work. This is very, very early days. We've only recently met to decide this, but we're very excited about this initiative, and stay posted for more in the future about this. So back to the 6 core elements of GOT transition. The third element identified by GOT transition is transition readiness. And transition readiness is basically using some form of a standardized assessment tool, which can be really helpful in engaging youth or families in setting priorities for their health care, in addressing self-care needs, and in navigating the healthcare system. And there are many, many wonderful readiness questionnaires out there now. Most of them, if not all of them, or most of them, I guess I should say, are generic tools. Not all of them are validated, but some of them are. And GOT Transition does have its own tool that you can find in their website. And it used to be that transition readiness was only assessed right before that actual transfer to adult healthcare took place. And in recent years, we've learned that, in fact, it's probably more useful to assess transition readiness on a regular basis, both at the pediatric and into the adult healthcare system, as a way of assessing how is that youth doing with their transition process, how are they moving through that transition process. At our clinic, we started using the generic On-Track Readiness questionnaire, which again was another tool that over time we adapted to be CF specific. And this isn't the whole questionnaire, but I'll just give you a sample of some of the questions on it. I understand how CF may affect my ability to have children. I am fully independent in my physiotherapy. I am comfortable meeting with healthcare providers on my own. I have set goals for when I finish high school. I know the names and proper dosages of all my medications. I am able to answer basic questions about CF if asked, for example, by an employer or a friend. So this is something that I used to ask youth around age 17 and a half or so, right before their transfer to the adult CF clinic. I would ask the youth to fill it out, and I would hand it over to the adult clinic so they could get a bit of a snapshot as to where the youth was at. I then pretty quickly realized that it may be useful to also administer right at age 17 or so as a signal to the youth and to to us as healthcare providers, okay, what goals do we still need to work on over the next year? And youth would say, okay, I realized in that last year, it seems to be a bit of a signal, okay, I've got about a year left. What are the things that I think I might still need to know? It starts to perhaps become more real to them. Well, fast forward again to the new and improved On Track initiative, and they have created this wonderful new youth quiz called I Am #OnTrack, a list of questions to help youth learn to manage their health and get ready for adult care. It's actually a 2-page quiz. I'm only showing you the 1 page, and this is probably more oriented to the pediatric center as opposed to the adult center. And again, they recommend that youth fill out this questionnaire once a year. I think it's starting at age 14. Not everything is going to be pertinent to them at every time period. But again, this process is meant to be gradual. It's meant to follow along with their normal rest of their adolescent development and progress. Back to the 6 core elements from the GOT Transition Initiative from the States. They identify the 4th core element as transition planning. Now, we don't have this in our transition program, but it's a 1-page concrete goal setting that the healthcare provider sets with the youth, including a date for the goal to be met. And this is meant to tie in back to the number 2, transition tracking and monitoring. And I do quite like this idea of setting concrete goals because it gives you the opportunity to see where the youth is at, what's important to them at the time, and to go ahead and set some concrete goals. Transfer of care refers to the importance of having a transfer package that you send on to your companion adult clinic. For example, at our clinic at BC Children's Hospital, we send the completed Readiness questionnaire, the completed transition pathways, as well as a quite comprehensive we call it a medical transfer summary, but it's the whole team that contributes to that transfer, and we give a copy to the youth and family and a copy to our companion adult CF clinic. The last point, or the last core element, is entitled transfer completion, and this whole idea is newer in terms of transition care. GOT Transition has created a survey, an optional youth survey that they ask the youth to complete in terms of how they found the transition process at their center, at their pediatric center, and they use it as a type of audit as to how their transition service is doing. At my CF clinic, we're also looking at this in terms of engagement at the adult clinic. And last year, we did a quality improvement project where we looked at what was the time between the last appointment at the pediatric clinic to the first adult appointment. How many adult appointments did they have in that first year, i.e., were we seeing engagement into the adult clinic? And that whole idea of engagement is becoming more and more important. In CF, we actually have it really good in that we have wonderful adult CF clinics to transfer our patients to. That's not the case in all chronic childhood diseases, and so this is the vulnerable time period where some youth are getting lost to follow-up. So that whole idea of transfer completion and looking at success of transition programs is becoming more and more important. So on to the next subject. Parents and families, it should go without saying, play a major role in their child's transition process. Now, that's not to say that families, that parents' role doesn't change over the course of their youth transition process. It does. Remember, during these years, parents are changing from being a full advocate of their child's health in the early days, slowly and gradually, to becoming an ally to their child. I have a couple of small handouts that I sometimes give to parents, written by two parents, not of children with CF, but of other complex chronic health conditions. This one parent, Kristen, talks about how parents should be taking their own transition baby steps that lead to major milestones, and how it starts with parents themselves. This other parent, Janet, highlights 4 points for parents on their journey from becoming advocate to ally, and she titles them: number 1, it's not about you; number 2, let go of the idea that your child will make the same choices as you did for them; number 3, that professionals need to let go too; and number 4, that letting go might look different for each parent. Getting back to that homepage for the On Track Transition Initiative out of BC Children's Hospital, if you look at that red box, the Family Toolbox, and if I were to go to their website and to click on Family Toolbox, these activity cards would come up. And these activity cards are, as it says on the screen, tips, activities, and resources for parents, families, and others to support youth in the development of knowledge and skills for their transition to adulthood and adult health care. And if, for example, I were to click on Action, what I would find is Action equals empowering your youth in their self or shared health care. And there's a whole list of items below that you can click on to learn more. So if I scroll down and click on Tests and Results, this is what comes up. All kinds of little tips and links. Ask for copies or take a picture of test results. Track It. Track It is a phone app that youth can download onto their phone. This is something that I just found out recently. At 16 years of age, youth can set up an e-health profile to access all their lab results online. So all of these tips and supports are available, one set for parents or caregivers or families, and another set for youth. Some of them are the same, and some of them are geared to the different individuals. Some of them lead you to Sick Kids' website for different tips. Some lead you to a short little video clip from an adult who has gone through transition themselves. But there is a wealth of resources here. So in conclusion, I wanted to put up some take-home messages for you. Transition process is complex, and the program guiding it needs to be multidimensional. Every pediatric and every adult clinic should have a transition program. Start early. This message is so important because if we start early, then we can better mimic the normal growth and development process, the normal development process of these teenagers. I think starting early and going gradually not only normalizes the process, but it makes it easier on the youth, it makes it easier on parents. Parents and caregivers do play a crucial role in this process. Recently, I had someone from the CF Canada's Adult CF Committee email me and asked, is there a role for adults in this process? And I said, absolutely yes. I think it would be wonderful if there could be, for example, virtual mentors of adults with CF who have been through the process themselves. From a healthcare provider point of view, every CF team member needs to buy into the importance and validity of transition and to contribute to that process. And finally, don't reinvent the wheel. Today we have many excellent models that are user-friendly. While the transition process is complex and the program guiding it, yes, needs to be comprehensive, it's not an all-or-nothing venture. You can start with one quality improvement initiative, one piece of the transition component, and that will in and of itself immeasurably help your clinic to start to address transition. So don't reinvent the wheel. Do be shameless in begging and borrowing and stealing from the different transition initiatives. That's what they're for, and they're out there for all of our guidance. And finally, I want to end with this wonderful picture of a young adult who's an adult with CF who graduated from our clinic about 7 years ago now. And at his graduation clinic, he and his family presented us with this lovely framed photo where he thanked us. This picture really says it all. It's certainly why I do what I do, and I'd like to thank everyone today for listening. I'd like to pass it over to Christine, and I look forward to answering any questions after Christine's talk. Thank you.
Thanks, Anna, for that really informative presentation. That was great. It brought back a lot of memories. And hello, everyone. I'm just going to start out very quickly by saying that our transition experience was very smooth. So I will give you a bit of background on our son, Darren. He was diagnosed with CF at 3 months of age. CF was suspected quite early due to failure to thrive and some other issues, but the main issue that got us quickly to the hospital was Darren had severe tracheomalacia, which would cause him to stop breathing. And just for the information, tracheomalacia occurs when the cartilage in the windpipe hasn't developed properly. So instead of being rigid, the walls of the trachea are floppy, so breathing difficulties begin soon after birth. And Darren's entire trachea was floppy. It wasn't just a portion of it, so he used to have several episodes where he would stop breathing. CF-wise, he initially was digestively more effective, and by 2.5 years, he equated eating with pain, and he gave up eating altogether. So we had to have a G-tube inserted, and the doctors finally came up with a great combination of drugs to help his stomach with emptying. So we were on our way to leading a, quote, more normal life. So in the early days, Darren did not care for clinic at all. I'm sure Anna can attest to some of this. He was pretty good with the nurses, but quite distrustful of the doctors. He did not like to be poked and prodded. But the staff were very good. We had very open communications, and they were very supportive and respectful of us as parents being involved in our children's treatment. So I was never afraid to say no if I felt it necessary. If a certain treatment option was suggested and we didn't quite agree with it, I felt quite supported in my decision to say no. And Darren, he was quite good. You know, if we were okay with it, he was okay with it, and you know, he would look at us during our clinic visits and look at the doctors and look at the nurses, but always come back to looking at us. And if he saw that we were comfortable, then he was comfortable as well. So by age 12, Darren had no issues at all with being hospitalized. He turned out to be a very social child, and he loved all the attention from the nurses on the ward. He used to make his own rounds. He would unplug his IV pole, and he would go visiting everybody. And he got to be quite comical, his little routine of leaving his room and going on walkabout. So gradually, as Anna alluded to, in his mid-teens, Darren started transition process, although we officially like to think of his transition as lasting 1 year. It was sort of between 17 and 18 when he really started to pay more attention to what was being said to him. Darren is still, at this day, he's young for his age, so it took a lot of love and patience to get him to realize that, hey, you know, this is important information and you really need to listen and complete these questionnaires and, you know, pay attention to what's going on. And I just have to comment on these photos of Darren. For 10 years, I guess he started at age 8, he was a competitive Irish dancer, and it was fantastic physio, and it was really, really good. It helped keeping his lungs clear. I was sad to see him give it up a couple of years ago. So at Darren's request, we attended his first adult clinic only, and we met the new team. We had, as I say, everything was pretty smooth. We did have one sort of miscommunication wherein a negative sputum test was reported 6 months after the fact. So Darren went to clinic, and then he gave me a phone call at work. He says, "Hey, Mom, did you know that I cultured Pseudomonas 3 months ago?" And I thought, that doesn't quite sound right. So again, with his permission, I phoned the clinic, and they were quite receptive to my phone call. And they looked into what happened, and I actually got the doctor phoned me back later in the evening to personally apologize for the mistake. I mean, it was human error. It was a mistake, and it turned out fine. There was no, negative results for Darren, but it was reassuring to know that the adult clinic did not mind me as a parent phoning, and they were very receptive to that. So Darren is still at home. He will be 22 in September, and I do remain involved in his CF care only from the point of view that I prepare all his daily medications. We're working on getting him to do that, but it's still not quite there. I mean, he does all his own physio and that, but just getting the pills all organized is I still look after that. But I like Anna's comment about going from being an advocate to an ally. It is hard to step back, but you do have to realize as a parent that it's their life and their disease, and they need to manage it. And it's hard to step back, though, especially if you see physios being skipped. But again, it's love and patience. I always resort back to love and patience. And luckily with Darren, he and I had very good communication, and he has doesn't hesitate to question me if he, something doesn't, he doesn't feel well, or if he, forgot to do something, or something comes up at clinic. He's very good, and he and I discuss it. So I'm involved, but I'm not involved. I am trying to step back more. And that's it. I mean, it's pretty short, sweet, and to the point. But as I say, we had a very smooth transition, and I guess my main advice is to be open communication, respect your child's space, and So thank you.
Okay, thank you, Christine, for your talk. So now we'll open the floor to questions. So you can either click on the little hand icon to raise your hand, and I will unmute you so that you can ask your question over the phone. Otherwise, you can also type your question in the Q&A section. So we have one question here from Ian. So Ian, go ahead.
Oh, hi there. Thanks, Tanya. Thank you both for very interesting talks, and in particular, Anna, just thank you, as always, an excellent talk. We look to you as a leader on this subject and are very grateful for your time today, and certainly for all the work you do on the subject. A question I had is just something that we hear occasionally across the country is when a patient simply doesn't want to transfer, doesn't want to make that move, it perhaps isn't mature enough or ready. And then the other side of it is what happens when we'll hear sometimes we'll be visiting a pediatric clinic and they'll say, yeah, we transferred someone over, but they sort of keep coming back here. And it's, what do you do in those situations? I mean, a plan is useful and important, but if it doesn't work, then what?
That's a very good question. So I think everyone can probably hear me now. Yeah, it's definitely transition can be a very complex process. I think that's why so many pieces need to be in place. And if all the little pieces are in place, I think you are giving yourself the very, very best chance so that those things do not happen. So, for example, at our clinic, we introduce transition at around age 10, and we say to the youth and their parents, it seems like a long way away, but in around age 18 is probably the year that you're going to graduate from high school, and it's also the year that you will graduate from RCF clinic. And we actually have a graduation clinic. It's our last, also known as a transition clinic. We hand out a graduation certificate at the end from our clinic director. So right from that early age, that idea is introduced. And if you are working on some of those skills gradually along the way, I think the chances of you running into those problems are going to be less and less. Now, certainly a comment that I have heard over the years is, should we have a distinct age to transfer? Maybe 18 is too young for some people. And while I think there could be an argument made for that, my own personal opinion is that I would rather see one age and to instead recognize that the transition process needs to continue on the other side. I'd like to see adult clinics, as they're starting to do now, to address transition issues on the adult side. And I think you don't ever see someone who's 24 saying, wow, I wish I was still in high school. I think if the appropriate services are in place, then also parents will have the confidence, okay, my child is a young 18-year-old, but they're still going to continue to get some of that transition help at the adult center. So they're going to have more confidence on both sides of things. I don't know, does that answer your question, Ian?
Oh, absolutely. Yeah, that's
okay.
Useful. Thank you. Yeah, and another point that a couple points that you made that I think are just so important. Something that I've heard over the years is that transition is almost as much for parents as it is for the patients.
Yes.
And another thought is that transition begins at diagnosis.
Absolutely. Yes.
Those are the key things for people to
Yes. And actually, I meant to bring up, but forgot. I know I think it might have been in the question and answer period of Lisa Green's talk. There was I can't remember if it was a question or comment from a parent about transition and about should parents be in the room with their child at clinic, because, for example, if you're an adult and you're going to see a specialist, you would often bring someone with you. And I know that topic can be a really emotionally loaded topic. And I think what we need to do is to really address all the needs that are there. So, first of all, to realize that the idea of having a youth in the room on their own is in many ways in their best interest, because they need to develop the skills to interact with healthcare providers. Again, we don't expect them to learn that in one go. We also recognize not only the need for the parent to have good communication, but for the health of the child, for communication all around still needs to be met. And so, for example, what we are advocating at our clinic, and I have to say we're not always the best at remembering to do this, but what our policy is around age 16, for the youth to start seeing members of our team on their own. The doctor is the last person to be introduced to do this, and for the whole time, even right up to the time that they graduate from our clinic, they only see the doctor for half the time on their own. That helps them to address their needs to learn how to communicate with a physician, and then the parent is to be invited into the room for the second half. It also allows the youth to speak privately with the doctor. So I just wanted to mention that part as well.
Yeah, great point. Thank you, Anna.
So, Anna, following on Ian's point, you've described a very comprehensive program to prepare the youth for transition of the course of a few years at the clinic. Is there any advice you could offer to parents who've until now have been very fully involved in their child's care, but who might now find it a bit difficult to hand over full decision making? Is there any advice you could offer them to help ease their transition into their child's transition?
Yeah, that's a very good question. I think my advice would be to start with baby steps. That's really important to start with baby steps. Talk to their youth. Talk to their team. So much of healthcare is about establishing a trusting or therapeutic relationship with the team. In something like cystic fibrosis, where it's a chronic condition, we get to know our families really, really well. And I would really encourage that parent to start to speak to their team about, do they have some suggestions as to how they can perhaps start to hand over some of the reins to their child. There can be some practical steps that they can do as well. Now, one thing that I have sometimes suggested to parents who are, at the time of graduation, if they are really still worried about, they're worried about being completely cut out of their child's health care when they reach the adult clinic, I will often suggest to them, why don't you make a deal with your child and say, okay, please come back from your adult CF clinic appointment with 2 pieces of information. And I often recommend those 2 pieces of information to be weight and FEV1, which is a measure of lung function, because those 2 little pieces of information can tell a parent so much about what is going on. And if that weight is stable and if the lung function is good, then that can give the parents some ease of mind. And if there's been a change negatively with either of those numbers, well, then that can be a point to open discussion with their youth.
Okay, thank you. We do have a couple of questions that have come in over the chat. So the first one is, what do you do if there are no adult clinics? Very good question. Okay, so we know that in Canada today, I believe this information is current, that there are only 2 clinics, pediatric clinics in Ontario that don't have their own companion adult CF clinic. And in one case, they are transitioned or transferred over to a neighboring adult clinic a couple of hours away. And in the other case, I believe it's in more northern Ontario, it's the adult team from St. Mike's Hospital in Toronto that follows those patients, and they do traveling clinics. So in Canada, although in those 2 situations, it may not be absolutely ideal, they are still being followed by adult clinics. I would say if you are living in another part of the world where there is not an adult clinic where you maybe have to travel a long distance, then at a minimum I would say to try and make those arrangements to travel at least twice a year to an adult clinic, and then maybe perhaps there can be some other type of shared model of care. So I see Joanna has a question here, so go ahead, Joanna.
Thank you, Tanya. I have a question for Anna. In your experience, I was wondering if most patients have challenges with transition, and then I was also interested in whether there are unique challenges of transition for patients with CF and for their caregivers, for that matter, versus other chronic diseases.
Oh, very good questions. So yeah, I mean, there's always challenges for sure. There's challenges to life in general. Some youth are naturally more independent and precocious as compared to others. And, Christine mentioned Darren being young for his age, but the point was that he was still moving forward, even if those were taking baby steps. We certainly have some 15-year-olds, doing all of their own medications. That's not going to be the case. And in general, there's no right or wrong within a certain, range. Challenges can be, there can be many, many challenges for sure with CF as compared to other chronic conditions. I would sense that the biggest challenge in that regard is as it pertains to CF being a progressive condition, and when I talked about the stakes being so high that if an adolescent is rebelling and not doing their care, and if they lose permanent lung function, well, those stakes don't get too much higher than that. So I would say that that's probably the biggest challenge. I think a lot about Lisa Green's wonderful work with her Love and Logic and the approach to parenting, and to have healthy parenting skills in dealing with chronic conditions. Those absolutely 100% pertain to the entire transition process. I think there can be a lot of challenges when there are added health concerns to the CF. So when people have other chronic health conditions in addition to cystic fibrosis, when there are mental health issues, either with the parent themselves or with the youth, when there's depression or drug addiction, those absolutely can put huge challenges on and require a lot more resources. And these are all yet more reasons to start the process early, so that hopefully we can pull in the appropriate resources for this. And I mentioned before, and it really is so important, that transition is not something that's just for the nurse or not just for the social worker. The entire CF team, the youth, and the family are all important members. There has to be buy-in from, for example, from the clinic director. We have so much support from my prior clinic director and my current clinic director. They value transition as something that's important. Every clinic member, the doctor, if the doctor is still talking to a 15-year-old's parent and not to the 15-year-old, well, that's just going to add to the problem. So the entire team has to be engaged in this process as well.
Okay, and actually I just have one follow-up question. Have you noticed any difference between genders when it comes to transition?
Not really. I mean, I know in general there's an idea that perhaps boys mature more slowly than girls, and perhaps I have seen this a little bit more. Yeah, I guess I would say perhaps it's generalizing to a certain degree, but it may be that some girls when we graduate them at age 18 that are perhaps on the whole a little bit more mature. And again, we're not trying to force maturity on someone. We're trying to keep them moving along, and I think also that this is yet another reason why a transition program at the adult clinic is hugely important.
Okay, thank you.
Okay, I think we have time for one more question here, again, through the chat. So what if the child is moving away to a different city to go to university or college?
That's another excellent question, and there's a lot can be a lot more angst associated with that. It's helpful for us and for parents to know in advance if this might be a possibility. Of course, that's not always possible, but in general, if you're working on those transition skills early, then hopefully that youth is mature enough and responsible enough to be doing this. Now, in terms of we've been in this situation in the last several years, so I can tell you a few practical pieces. So in terms of transferring to an adult clinic and going away to university, the medical care is covered all across Canada as long as it's a Canadian university. There are CF clinics in every province of Canada, and I know, for example, the adult clinic in Vancouver is happy to do a shared care model with a clinic in Toronto or in Saskatchewan, anywhere else in Canada. The issue of medications is a little trickier. The medications need to be ordered and purchased in the home province and either, picked up or shipped to the child. It's a bit similar to traveling when you have CF. It's doable, but it requires a lot more organization. We were fortunate in that we have had the experience of someone going away to university in another province, and I asked that set of parents and their young adult with CF to email me how they felt it was going and some tips, and I anonymized that information. And this year we were in the same situation, and we'd been talking for gradually over the past year about the possibility of this happening, and I was able to provide the information from the parent and the youth. And it worked quite well in the case of the one parent. I think their child is in their second year of university now.
Okay, thank you. So I think that's all the time we have for our webinar today. So we'd like to send a big thank you to you all for joining, and to both Anna and Christine for their informative presentations on transitioning. So thank you to you both.
You're very welcome.